Hello, my name is Brianna RN, and I'm your CNA instructor. Let's go ahead and get started with the lesson. We're going to cover Lesson 2.1, Ethical Responsibilities of the Nursing Assistant. I think it's very important to cover the introduction of the reason why you need to know these things, okay, while we're studying this lesson, all right? In this unit, you will learn about professional responsibilities associated with becoming a licensed nursing assistant, okay? Resident rights are the forefront of providing care to ensure quality of life for dependent individuals. You will become familiar with the agencies involved in regulation of long-term care, legislative acts that uphold resident rights, and the nursing assistant scope of practice. You will gain awareness about the role within the healthcare team, the facility, and the nursing process, as well as a variety of healthcare settings in which you may work as a nursing assistant. To better break that down, you're learning your responsibilities to be an ethical nursing assistant, okay, healthcare professional. Yes, we need to know those rights, the rights of the residents, how you can't treat them, okay, because this is big, all right. You're gonna get in trouble if you're not treating them right, all right. The quality of your care depends on these patients' rights, okay. We're not gonna turn Miss Sally over rough. We're not going to call her name because you have to change her. Okay, we're not going to not answer call rights because this is her 15th time pressing it. No, we have to respect the patient. You're getting paid to give this quality care, so give it. If you're not going to give it, don't do this job. We're going to go down to the unethical behaviors in the healthcare setting. We see a lot of TikTok videos of what CNAs are going to do because they're tired of answering the lies. They're not really washing their hands and stuff like that. But we're going to jump into that. But that's unethical. Those are things that should not be done. It's not respecting the patient. And if it were you wouldn't want that done to you. Okay, you wouldn't want someone to act like you're pressing your call right is not important. Okay. Some things that are unethical we're going to discuss here. Using personal cell phone in patient's care area. When you're in a room or in the shower, hey, no, we can't do that because while you're talking, you could be missing those signs if a resident becomes abnormal. Okay, they might be having a stroke and you be on the phone and you're missing the signs that could catch it early. Not responding to call lights promptly when you are available to do so. You're the CNA for that hall. If it goes off, go answer the call light. I see a lot of TikToks where the nurses don't answer the call light. You are responsible for those call lights as well as everyone is, but you are paid to work this hall, answer those lights. The nurse is busy trying to summarize what's going on with the patient. She's done her mid-pass. We can't be too focused on what the nurse ain't doing. We need to focus on what we as a CNA should be doing, okay? Ignoring the phones assigned to you. Some CNAs are required to answer the phone. I'm not answering that phone because, look, you're not at home. You are responsible for the care of other human beings, okay? That call could be the lab telling the nurse that we have an important a critical lab that needs to be dealt with. Send them to the ER. So don't ignore the phones, okay? Using agency computers for personal use. Some people might be using FaceTime on the computers. That is used for the patient. If you're on the computer and one of your residents come by and look at you, they're going to be like, they're not going to feel as comfortable. They're not going to feel like you're going to take their life seriously. So don't do that. Avoiding clients because of their ethnicity. You might deal with some racist. I have worked with it all, okay? You can't let that prevent you from doing your job, okay? Also, you can't say, I don't want to take care of this resident because they're black or they're white or they're Asian. You can't do that. That's discriminating. It's like a line. The patients are like in a metaphorical line. Whoever's next for you to care for them, you take care of them no matter what they look like. You are required to give that quality care, okay? Avoiding work by sitting in empty patients' rooms or the break room during on-time work hours. It's important that you as a CNA is doing the rounds, okay? We can't, as a nurse, we cannot be in every room at the same time. While you're changing that patient, you might see something's off with this person versus me as a nurse passing medicine on the other end of the hall, okay? And that's why it's imperative that you understand why you answer those call lights. You do your checks and your rounds. We can't see those things when we're going out the room when we're handling someone else, okay? Sharing clients personally, and this is a no. We can't call on the phone, talk to a friend, and say, hey, I want to talk about this patient that got on my nerves here. The patient, for one, don't need to be hearing you say they got on your nerves, okay? Because if it's something big that they want to talk about, they might feel like they want to hurt themselves, and they might need it to be you to tell the nurse that, hey, we need to think about suicide. And if they hear you say they get on your nerves, that's not going to make them want to open up like that. So we need to be mindful that these patients are vulnerable. They are needing other people to assist them. That's not always easy. So we need to make that environment comfortable for them to open up and allow us to care for them. Stealing items, this is a no. We cannot accept gifts from family members or the resident. We are paid to give them that care, okay? Don't make them feel like they have to pay you extra because you're doing your job. Don't do that, So we need to understand that us as human beings, we get carried away with our emotions and want to put how we feel off on other people. Well, I don't think you need your medicine, or I don't think you need to be changed right now. This is why we're going to talk about the next subject: governing agencies, okay? Excuse me. So I hope that you have read the governing agencies section, so that this brief talk about it can make things click. If we were to put random people in a nursing home and say, hey, work, 9 times out of 10, there's nothing going to be getting done, right? We're going to get carried away. I'd rather be on my phone than do my job. We especially with the younger population, okay? So we need something to govern to make sure that care is going to be given. Our governing agencies, okay? We're going to go over pretty much all of them. The Centers for Medicare and Medicaid provides funding for people who qualify because giving care costs money, okay? Nothing's free here, all right? And but everyone doesn't have the budget for that. So these programs are available to help you get that care so that you're not just up here suffering, We got CDC, they Center for Disease Control. Okay, if there's a disease, they have the information about it, so how to manage it and deal with it so that it doesn't have an outbreak. That's important because you might work in a facility where a person has a disease like HIV, and if people working there don't know much about it, you can call these people. You should know about it, but if there's an outbreak or something like that, these are the people you call. It's important to know these people because you might go to a facility where things are out of whack, and you need to know which direction to take to get that taken care of. Because if state come in there and they look at how long you been working here and this has been going on, you might get in trouble too. So if there's a problem, you need to locate which agency to call to get regulations regulated. You know. FDA, if you're working at a facility and you feel like the food that they're serving the residents is trash, they got roaches in the food or bugs or rats, you need to call FDA, DHS, all of them, because what if it was your mom or dad at their facility? Would you want that to be going on? Well, I'm looking to let you know that there's help. You don't always have to go to the DON or the administrator of the facility. For goodness sake, they might be trying to cover up stuff. You call the state regulators that's going to regulate these rules that's supposed to be going on, okay? But they don't come here and shut stuff down if they don't get it fixed. Occupational Safety and Health Administration. You need to know what this is because you might go to a place and you might feel like you're stuck there, but the working conditions are out of whack. Okay, they got they're having you to, let's say, pick up heavy stuff that's not even wires, wires moving out the way. That's broken stuff that it's not safe for you. Bullying, fighting on the job, or those conditions aren't safe. It could be a shortage in the nursing staff. Call OSHA. Okay, the working conditions matters. All right, DHS. This is located in every state. Any kind of abuse or anything like that, you need to call DHS and they're going to get that. It's just real. It's important to know the different while they're there. All right, DHS is going to regulate if someone is getting hurt. OSHA is going to cover if you're getting hurt. If the working conditions are safe, FDA is going to cover if medicine that should be given is handled, or the food is okay to eat, or the different stuff that the facility use to make sure that it's okay to use. If you know that this lotion that they're using has bleach in it, and you're like, I know that they're not using this product, call FDA. They don't come down and get a sample and shut it down if it is what it is. Okay, don't be afraid to make the conditions better for you and your residents. Okay, because some nursing facilities, they don't really care. They're in it for the money, and I have worked at plenty. Okay, so don't just try to be savior of the facility. If they're not doing what they're supposed to do, you need to call these people because you're gonna get in trouble when I call. You are a mandated reporter at this point, and if they are not getting taken care of right, you're gonna be held responsible. So cover your ear and call these folks. Let's talk about HIPAA. Oh, this is so important, y'all. These social media accounts that have pictures of the residents talking about, we can't do that because if they find that, you can go to jail. Take this for instance: a person or a patient has HIV, and you're like, oh my goodness, I didn't know that this person. I've been going to church with this person for years. I'm gonna check that birthday. You're gonna go to jail if it's caught. All right. No one wants your business in the street. Okay. And even if it is in the street, no one wants it there. So you don't need to be that person who's putting these residents' business on Front Street. They want their stuff sacred. It don't matter how comfortable you become at your job. You've been a CNA 15 years. You know the rules and trends of this. No, you need to still keep that. Be humble. Okay. And calm down and understand that your job is important, way more important than your comfortability in doing it. Okay. Keep this at zero. Don't be talking about the resident's condition that made you mad. And okay, now if you're gonna just talk about a resident, you don't need to say their names. You don't need to know the facility they're in, their age. You need to act like you're talking about Barbie. If you're talking about Sally, the person you talk to need to feel like that you're talking to someone about an alien from outer space or something. It does not need to. Shouldn't have the keys to connect the dots. You were saying, well, I dealt with someone who had COPD and they were breathing real heavy. You might be trying to help somebody out, given your experience, but you don't need to disclose any names. Keeping their care plans, disclosed from people's view. They've changed the laws to having the care plans in the closet now. They're on the computers. So because that is an issue. A resident family member might come in and might think that that's their mom's closet and open it, boom. So it has to be confidential. No one wants to. This is why. If let's say I had HIV, if you were to tell somebody that and I didn't want them to know, that would make me want to hurt myself. Let's say even if you do have HIV, would you want somebody to know if they knew how would you feel? You'd be embarrassed. You have low self-esteem. You probably have suicidal ideations. Yeah, just think about if it happened to you, someone told a real major secret in your life. How did that make you feel? Yeah, it makes you feel weird, stranger, or something like that. That is exactly how these residents feel. Cover up that stuff. They don't just keep it on the low. The Omnibus Reconciliation Act, that is why you as a CNA must have training before you just go and take care of residents. It is required that you have to have a minimum of 75 hours and pass a test, competency test, to make sure you know what you're doing, and then you can work with people. Because if I just got random people off the street and say, hey, come take care of my residents, they're not going to know what to do. I have worked with nurses and some CNAs new who didn't know how to change a bed, didn't know how to put a brief on, didn't know how to do pericare. The list can go on. So you have to be trained to know how to do those things before you just, it might look easy. It's easier said than done, okay? Because there's steps that you have to follow. So this is why this training is essential, CNAs. And yes, only a nurse can train CNAs, not a doctor, not yourself. Has to be a nurse. So decisions are made based off the health condition that is specific to a patient. Let's say I had COPD. Well, my diet is going to be more protein based because I'm doing a lot of breathing. I'm breathing off a lot of. It takes a lot of energy, a high calorie, so I can breathe better, especially if it's really, really bad. Versus someone who doesn't have that. They don't need a special diet to maintain their health, to get their nutrients. So these decisions are based off, the healthcare plan, all that stuff is based off of the client's condition. you as a CNA have to be mindful that you are to give respectful care. You can't say, I'm going to do more for a COPD patient than a person who ain't got it. You know, it should all be the same, respectful. And that's why these governing agencies are here to govern that, and also these acts to help ensure they're going to get that quality care. They're going to have a trained nurse taking care of them who knows what they're doing. They're going to have a nurse who's going to value privacy, not disclosing their information, because they know what's going on with the patient. Okay? The Older American Act, this was established for the older clients who are in the community not getting care. So for healthcare assistance, home healthcare assistance, the same rules apply, you know. Because there was a lack of social services for the older adult clients out in the community, they made this act for the state to get on it. Okay? We're going to resolve problems that's related to health, safety, and welfare of the patient in the communities. For instance, if you have a family member who lives in a poor town, well, instead of the state ignoring that, they're going to jump on it. Not a lot of people want to work in these, scary towns, but we're going to provide that for y'all because it's needed. Okay, big overall reality shock here. Without these healthcare regulations, you'll wake up one day and all those stinking bodies everywhere. It reeks. All these, we're going to do all these bodies just lying here. Okay, we don't want epidemic of humans dying anymore, especially from us not giving that care that the state tells us to give it. If we're not changing people trying to get skin break and die, if we're not feeding them, they will die. If we're not giving them medicine, they'll die. We need to regulate the health, the human life. Okay, it's basically in our hands. So these rules and laws are here to make sure that you, as a person saying that you want to be a nurse or CNA, and you become that, these rules are to make sure that you're going to do what you're supposed to do, and if not, you're not going to be in this field anymore. Because if it was just up to you, you probably wouldn't take your time, just pop show for a check. So you need to make sure you're not doing that. I want to make sure that you've read these pages to this lesson, so that what I'm talking about, it'll all come together and click. I'm going to always read my conclusions, okay? So, if there were no one ensuring that you are doing your job, chances are one day you might start to slack to the point of doing nothing at all. These governing agencies are important in keeping as many patients alive with these regulations as possible, okay? No one wants to wake up one day to an earth filled with dead bodies from nursing homes, hospitals, or homes in general. Be glad that these laws are established to keep your environment grounded. If your facility is lacking in either of these regulations, pair them with which act is stating the issue and call those numbers. There's a part 2 to this lesson. This was just covering the governing agencies and the patient's rights. We haven't even really gotten to the patient's rights, but to know that clients have rights that must be given and respected. We're going to cover that mostly in the next section. But here we got to talk about some unethical practices that you might see. And you might see more than what we just listed. But just know that that's unethical. You being late. Unethical. You want to run the tire to work. Unethical. Everything that's bad that you do at the job is considered unethical. Versus what is ethical is what you're supposed to be doing. And we have these laws and governing agencies to ensure that you are doing the ethical practices. And if it's unethical, they catch you, you're going to get dealt with. Alright? Scan over it. We talked about the healthcare acts that help to ensure that clients or patients or people in general can get access to care. And it's going to be confidential. Talked about why you as a CNA have to have training. You don't know how to make a bed in a facility, do you? You don't know how to spot when a person's having a stroke, do you? You might know if you've dealt with it with family members, but for the ones who don't, you don't know how to, or what to do when a person have a seizure unless you've experienced it. We're teaching you as in a matter of you don't know this at all. So we have to break it down bit by bit, because it's not as easy as it looks. Definitely patience. When you're dealing with patients' rights and stuff, you have to have that patience, okay? And we're going to cover that. Just stay tuned for the voiceovers and presentation. We'll start with lesson 2 next. Thank you.